One of the most common questions people ask after diagnosis is whether macular degeneration can be reversed. In this lesson, we'll talk about what current research and treatments can and cannot do. Welcome to Macular School. I'm Corey, a certified low vision therapist. In this series, we explain macular degeneration and share practical strategies that help people stay independent as vision changes. Today, we're looking at whether macular degeneration can be reversed or slowed. After diagnoses, people often begin searching for answers very quickly. They may search online for cures, new treatments, or breakthrough discoveries, and sometimes they encounter information that sounds very promising. But it's important to separate hope from evidence. At the present time, medical research has not discovered a cure that completely reverses macular degeneration. That means doctors cannot currently restore the macula to its original state once damage has occurred. However, that does not mean nothing can be done. Modern medicine focuses on slowing progression and protecting remaining vision. And that approach has helped many people maintain useful vision for many years. The current goal of treatment is to manage the condition, not reverse it. Macular degeneration is generally considered a chronic condition. Like many long-term health conditions, the focus is on monitoring changes and responding appropriately when needed. Doctors work to identify risk factors, monitor the health of the retina, recommend treatments or lifestyle changes that may help protect vision. For many people, macular degeneration progresses slowly over time. That means the most important strategies often involve regular monitoring, healthy lifestyle choices, and early detection of changes. Understanding this helps people shift from searching for a cure to focusing on protecting the vision they still have. There are two main forms of macular degeneration. The most common form is dry macular degeneration. Dry AMD accounts for the majority of cases. This is the form of the condition where small deposits called drusen develop beneath the retina. These deposits can gradually affect how efficiently the macula functions. Dry macular degeneration usually develops slowly. Many people experience mild changes that progress gradually over many years. Because of this slow progression, doctors typically focus on monitoring retinal health and identifying changes early. Regular eye examinations allow doctors to observe the retina and watch for signs that the condition may be progressing. The second form of the condition is wet macular degeneration. Wet AMD occurs when abnormal blood vessels begin growing beneath the retina. These vessels can leak fluid or blood. When this happens, vision changes can occur more quickly. However, there is an important difference with this form of macular degeneration. Treatments do exist for wet AMD. These treatments are designed to slow or stop the growth of abnormal blood vessels. They often involve medications known as anti-VEGF treatments delivered by a retina specialist. These medications have helped many individuals stabilize vision and slow disease progression. So while wet macular degeneration may develop more rapidly, treatment can play an important role in protecting vision. Even though macular degeneration cannot currently be reversed, several strategies can help support eye health and reduce risk factors associated with its progression. One of the most important steps is regular eye examinations. Routine monitoring allows doctors to detect changes early and recommend appropriate treatment when necessary. Another factor that may help is the AREDS vitamin formulation, which was studied in large clinical trials. For certain patients with intermediate stages of macular degeneration, AREDS supplements may help reduce the risk of progression. Lifestyle choices can also influence eye health. For example, smoking is strongly associated with faster progression of macular degeneration. Avoiding smoking is one of the most important steps individuals can take to support retinal health. A healthy diet that includes leafy greens, dark leafy vegetables, fruits, and fish may also support overall eye health. Research into macular degeneration is ongoing. Scientists are studying many new treatment approaches designed to better understand and manage the condition. Some areas of investigation include new medications, gene therapies, and cell-based treatments. Researchers are also exploring ways to better protect retinal cells and slow the biological processes involved in macular degeneration. While these studies are promising, medical research does take time. New treatments must be carefully tested to ensure they're both safe and effective. But the amount of research currently underway is encouraging. Scientists around the world continue working towards better treatments and a deeper understanding of macular degeneration. At the present time, macular degeneration cannot be completely reversed. However, treatments and strategies do exist that can help slow progression and protect vision. Regular eye care, healthy lifestyle choices, and early detection all play an important role in managing the condition. And many people learn effective ways to adapt to vision changes and continue living active, independent lives. Understanding the condition and learning about available resources is one of the most powerful steps someone can take after diagnosis.
The key idea to remember is this: while macular degeneration cannot currently be cured, treatments and strategies exist that can help slow progression and support daily life. In other Macular School lessons, we'll also explore treatments for macular degeneration and tools that help people maintain independence. Thank you for viewing. See you on the next one.